Okay, so how about, these are all short-term aesthetic. So we're talking about function and short-term function and aesthetic. How about long-term aesthetic challenges? Okay, so you have aesthetic challenges due to the loss of biological substance. So what are the things that happens when you lose? What are the aesthetic challenges you have? One is the loss of teeth, loss of mucosa, and the loss of bone in these areas. Okay, so aesthetic challenge is the most important aesthetic challenge, the pink and white aesthetic challenges. Okay, the pink and white aesthetic challenges. Replacement of teeth today as a functional restoration is no longer a question. In the sense that when you place an implant, you will have functional restoration, a good functional restoration. That means that you can bite on it, you can chew on it. That's not a problem. Osseointegration is no longer a real problem. Okay, it's no longer a question because you will get osseointegration in these cases. But does it really look good or not? That's the most important thing. Okay. So I got this guy who is the ketchup king of KL. Okay, he sells soy sauce. He lives up in KL, and by the time he was 55, he had almost no teeth. He had only one tooth left. So this was about 6 or 7 years ago. He came to see me. He said, "Doctor, can I have a functional?" And he didn't say can I have teeth? Can I have full teeth again, like I was 17. I said, okay, maybe. So he proved to me that he was good. So we then placed, I think around, I can't remember, maybe 13 implants up and lower. Okay. So he has smiling molar to molar, California white teeth, functionally able to gobble a stick on a bite. I placed 8 implants. 8 implants on the maxilla and 6 implants on the mantle. So he had 14 implants altogether. Okay, but look at him. Okay, he looks like a wall of teeth, doesn't he? Okay, he was very happy. He's very happy guy. But is this a aesthetic success? Functional success, but aesthetic failure. Because to me, it looks like a wall of teeth. Yeah, absolutely no character whatsoever. He's got teeth that are as long as horse's teeth. But he's happy with it. Very happy with it. Okay, when the patient is happy, it's like the emperor with no clothes, you know. You just clap, you know. But he got what he wanted. Okay, it's functionally a success. However, aesthetically a failure in the sense that there's too much white, yeah, but not enough pink. Okay. So today we have other ways of doing things. You know, how do we do it? How to restore pink aesthetic? And you know, the white aesthetic we can restore these days, no problem. We can do magic with the white aesthetic, but the pink aesthetic is the problem. So can we add pink aesthetic? Yes. There are 2 ways of doing it. One is the biological way of doing it. Biologically to restore the pink aesthetic means maybe a bit of graft, bit of surgery. Prosthetically to add pink gum to implant prosthesis. That's the other way of doing things. Okay, so how to grow gum then? Can we actually grow gum? I'm going to the rant of the periodontist here. Any periodontist around? Okay. Okay. I don't do this often, but you know, maybe we can do more of this. Okay. Okay, the loss of papilla. This is a tragedy. Okay, I'll tell you about this lady. Okay. Okay. As you can see here, she got teeth, she got teeth, she got teeth, she got implant. But actually, this is also an implant. Okay. This implant was placed by me in 1999. Okay. In 1999, she came to me in 1999. She was a junior in my University of Otago. She was a former model. She looks beautiful. Yeah. But what happened? She had a baby, and she had orthodontics when she was 14. The two doesn't mix together. What that mean? You know, you have a baby, and then you had orthodontics when you're 14. What happened was that when she had orthodontics when she was 14. I don't know, maybe she also had a medical history of keloid, yeah? Maybe it's related, I don't know. But what happened to her is that when she had orthodontics, I asked her how long the orthodontics was done. She said 11 months. 11 months for orthodontics? Wow, that's fast. So when we did an OPG for her, this was back in 1999. I'll tell you the story, but this is she actually came to see me from a referral from a general dentist. She was having mobile tooth, a mobile center incisor. We had a look at the X-ray, which found that all her teeth, most of her anterior teeth, had short roots, and we stipulated that maybe that the very fast orthodontic had given her external root resorption, and it was devastating to see that one of her tooth, the center incisors, was basically falling off. It was type 2 mobility. So we had to remove it and then place an immediate implant, and that's where that came from, in 1999. Yeah. So, and why did that happen? Because she had a baby and she was bouncing a baby one day, and the bouncing baby then hit her in the head, and that causes the fracture of the tooth. I mean the extreme mobility of the tooth. It didn't help that she had a short root. Yeah. So implant 2-1 was placed in 1999, and then tooth 2-1 accelerated when severe root resorption occurred due to orthodontic treatment of the previous decade. Then she came back in 2005. She said to me, "Oh my God, unfortunately the same things happened. I had another baby. I was bouncing with another one of my babies, and the same thing happened. She had a baby hit her on the head of the baby hit her on the face, and she had another mobile tooth. But we knew by then that it was the problem of external root resorption. The tooth was then replaced with an implant. Okay, but I wasn't so lucky this time because there was a little bit of papilla. You see, when you put two implants, when you have implant to tooth, it's easy. Papilla will regenerate. But when you have two implants together, you have this problem. Total loss of this papilla. And you know, the best of what you do is a bit of a hit and miss game. Yeah? So what can we do? Can we actually treat this? So one of the ways of doing it is, I believe, a free partial thickness flap was used. Yeah? So I had to see where can we grow gum or can we harvest some gum. So I thought, okay, let's find where we can get some gum. And the best gum to get is from the palate. There are miles and miles of gums in the palate, which you can actually harvest as a free gum. Eh? And I will show you. So I had some friends. We had a discussion, and we said, let's do something like a tunnel interproximal space. Let's tunnel it through and place the graft through between the 2-1 and the 2-2. So you know we had some ideas, and the patient was in for it and agreed, and that's how we went. So what I did was I did a tunnel through in between the two papillas. Okay, I tunnel it through. I strip that area, and then I went in and opened up the palate. You can see the blue. And there, okay, full thickness graft, identified, indelible ink used to mark the extent of the palatal graft. Took it out, okay, and then epithelium preserved one side and stripped on the other side. Yeah? Okay, so just the connective tissue is left, and then what I did was I tunnel it through to the papilla. Okay, and then we suture it back into place, graft position, and so far so good.